So these are the little muscles right here. And those move the eyeball around. So there's one on each side, basically. And there's this one, there's this one, there's this one. And then there's one little one right there. So it just moves. That's what allows the eyeball to move in the head, which is actually pretty kind of cool. And then, other than that, I think we're going to just take a little look inside with some scissors and see what it looks like. As long as you're interested.
Oh, yeah.
Yeah.
So if you have not seen enucleation, what happens is, basically what happens is you, first you block everything, right? You sedate them, you give them pain control. And then you suture the eyelids closed.
Okay.
Which is what this is.
This, okay.
And then you make a little elliptical incision around the eyelid margin right here. So that's what this is. This is the edge of the eyelid.
Okay.
And that does two things. One, it allows it to heal nicely, because obviously two eyelid margins with skin on them don't heal well together. So you create a little piece of tissue here that would heal well to this piece of tissue. And it also allows you to remove the whole globe kind of intact. So if there's anything in here, we've kept it inside of here, and it shouldn't be left in his socket, right?
Okay, yeah.
So I'm going to open up from this part, and we'll see if these scissors do the job or not. And there's liquid in here, okay?
Yeah, I know.
So that's the cornea, this thick white bit. So this is all cornea.
Yeah.
And this is the inside. This is the iris. Right here, and you can see that's partially degenerated. It looks like, which you could tell from the outside because it didn't the aperture didn't close properly. Oh, there's the whole cornea.
Yeah. Cool.
And then this is the vitreous, which is kind of jelly-like.
Jelly.
And that's the fluid that's in your eye. And it's a little bit probably yellow.
I was going to say, is it normally that?
No, and it could be that this is the result of whatever red blood cells were in here, like the end result of the pigment that was in them.
So that was
but
why
it
his
still
eye
looks fairly clear, so I would say
okay.
probably not on the white blood cells. It's probably the leftover pigment. Just like you might get in a bruise when it kind of turns yellow and green at the end. This is probably, it's hemosiderin is the pigment that's left over. But yeah, you can see how the iris is kind of definitely abnormal right here. I mean, I cut through it a little bit, but just this bottom margin right here is a little bit abnormal. So let's see. And this is the lens.
Looks like a black olive.
It does.
Let's see if I can get the lens out. And the lens is actually quite firm. So this is firm and kind of opaque. Sometimes you can look through it. This one I think is too damaged, probably. You can actually see this is see these little striations in it?
Yeah.
Yes. Yeah.
So that's probably sclerosis. That's abnormal. Usually it's quite clear, and you can almost look through it like a magnifying glass.
Oh, okay.
It should flip the world upside down for you when you look through it, right?
Oh, wow.
A clear lens you can see through it. Your eye actually flips the world, and your brain flips it back.
Yep, I remember from the...
Yeah, so if you look through a clear lens without damage, you would be able to see the world kind of flipped upside down.
There's a lot of striations.
Yeah, so there's a lot of striations, and I would say that's from the chronic inflammation that was in his eye.
Okay.
Just a result of inflammation and inflammatory processes, but it's actually quite firm as well. That's
Firm is
pretty
good
much,
or firm is bad?
Usually it's sclerotic, so lenticular sclerosis is probably why there's striations and why it's quite so firm. Although some of it might be some changes from waiting a day. And then this part, you can look, if you look inside there. So animals have a tapetum, which is basically a surface on the inside of their eye that reflects light back.
Okay.
It's why when you see deer in headlights, that it reflects back.
Reflects
And
back.
humans don't have that. And what it does is allows animals to see in lower light conditions.
Oh, okay.
And that's where the optic nerve comes in. That dot right there.
Yeah,
But
neat.
yeah,
That was really cool.
Thank you.
yeah.
That was super cool. You got the whole thing.
I have it all.